More now on that report that we told you about earlier this week, the Kids Count study by the Annie E. Casey Foundation. It ranks Mississippi as one of the worst states for child well-being. 12 News' Brandon Ring spoke with child advocates who say that our children need better access to mental health care.
The 2022 Kids Count data book published by the Annie E. Casey Foundation analyzes how states rank in different areas, such as health, education, family, and well-being. Mississippi improved in education, ranking at number 39, but the state ranks 50th in the country for health and 48th in child well-being. The report finds 10% of children and teenagers ages 3 to 17 in Mississippi had anxiety or depression, or both, in 2020. Linda Southward with the Children's Foundation of Mississippi says that number may be higher, as the report only includes children that have been diagnosed by a physician.
Many children who could be diagnosed with these conditions may not be.
Southward believes the COVID-19 pandemic made a significant impact on mental health, especially for youth.
These and other obstacles can compound a child's anxiety and complicate what might already be an emotionally charged process.
The crisis line in Jackson tells us it's seen a rise in the number of phone calls from struggling teens.
In the months of 20 to 21, we have around 525 calls from youth. During the months of 2021 to now, 2022, we've had over 1,500 calls.
The Annie E. Casey Foundation and Children's Foundation of Mississippi are pushing lawmakers to make access to care more easily available.
We could have more providers who are trained in mental health to be where the children are.
And push for state funding for school counselors.
When we think about how children learn with their cognitive abilities, language proficiency, social skills, they all develop alongside mental health.
The Mississippi State Senate will conduct 4 hearings on mental health care beginning September 27th. Reporting in Jackson, Brandon Rains, 12 News.